Hi, I'm Dr. Jeff Banas, and I'm going to talk about outside knee pain, pain on the outside of the knee. But more importantly, some overlooked issues that might be causing this pain on the outside of the knee. Because if you're watching this, I'm sure you've already searched the internet, you've already read all the articles, and you pretty much probably already diagnosed yourself with iliotibial band or some type of hamstring injury. But maybe you're still having problems, okay? Because I hear this a lot. I got an email the other day from a runner that can't run anymore because he's getting such severe pain in the outside of his knee. And he says he went to one doctor and said they told him his iliotibial band friction syndrome, so he's foam rolling the outside. He's using the foam roller on the outside of his leg and around his knee. And he hasn't been running, and after weeks of that, he's very frustrated because it hasn't helped at all. And then he said he went to another orthopedist now, and they're saying it's a hamstring issue. And again, massage the hamstring, work it out, and it really hasn't helped. So, and he's frustrated because he hasn't been able to run for a couple weeks. So, we talk about some overlooked things as far as outside knee pain, and what you could do, and what maybe some things that you haven't been doing. Okay. Now, usually when someone has an injury, you pretty much want two diagnoses. First, what's the pain that he's having on the outside knee, and two, well, what actually caused the pain in the outside knee? And a lot of times it's that second one that's not addressed. So maybe you go in to see a doctor, physical therapist, or someone. They say, yeah, you got iliotibial band. Use a foam roll and work it out. Okay, that's nice, but is that really the cause of the knee pain? Why did it start off? Well, here's what you could do, okay? You need to initially start, honestly, with deep tissue therapy. It is better to go see a sports chiropractor, a sports physical therapist, or a sports massage therapist first, and let them release everything in the legs. And I'm not just talking about on the side knee. In fact, most of the problem, the massage you don't want to do on the outside knee. Most of the problem, if you have pain in the outside knee, you need to focus on this muscle right up in here. But again, you're better off spending some money and going seeing a good and getting some active release, deep tissue, neuromuscular re-education along all the muscles of the lower extremity. Not just around where you got the pain. You know, one thing leads to another that leads to another. So by getting in there very specifically and doing like myofascial release on the tensor fasciae lata, on all the glutes back here, on the hamstrings, on the quads, break that up. Honestly, you could probably use the stick, which is with the stick. You could use the foam roller. You could do that for an hour a day and probably get very little results, which I'm sure if you're watching this, you've probably already done that. The stick and the foam rollers, those work pretty good after you spent the time to break that up. So the first thing you want to do is get some good deep tissue therapy done around the whole area. But when you're having pain in the outside knee, you need to focus on this muscle right here, the tensor fasciae lata. The muscle is right here, attaches onto the band down in there, okay? So, but what I'm saying right now as far as this treatment, now this is good. This is a good starting point, whether the pain's on the outside knee, the front of the knee, or the inside, because you want to release everything. You don't want to focus exactly just where the pain is. Sure, you can do some type of muscle stim in that area to help, but you still need to release everything. Okay, so doing deep tissue through the whole area, okay? All over quads, fascial glutes. Go ahead and still do the foam roller, but focus on the upper hips here. Another important thing to look at is your arches on your feet. Okay, so what you can do is just sit in a chair, get a little ruler, sit in the chair, feet on the ground, no weight on it, make a little mark on the inside of your foot and just measure it up to the ruler. Now stand up and see how much your foot drops and make another measurement. And if that arch drops a bit, and look at your foot, is it lined up or are you dropping down in? Because if that foot is dropping down in, that could buckle that knee down, okay? And that could cause more stress on the outside, more stress on the inside. It's just not normal, okay? I know a lot of people are really into the barefoot and the minimal shoe, but man, if you're running long distance, if you're rotating in, that's one piece of the chain that's going to affect. And when you're dealing with like chronic conditions like this, you need to just try to address everything that you find abnormal. Some people come in, or they want those very specific couple exercises that's going to fix anything. But you know, it's an accumulation of a bunch of stuff that ends up causing the problem. So break everything up. Look at the arches. If you're buckling down, go see someone about maybe getting a custom orthotic with like a medial wedge. A medial wedge means it's a little thicker on the inside than the outside, and it'll help that controlling. I personally don't like orthotics with big heel cups, because if you got a good running shoe, you already got a pretty decent cup in there. So deep tissue, possibly orthotic. Other things that you could do is get yourself something called magnesium oil. And you could get that at a health food store, you get that at Amazon. I got links on my website right to Amazon on some of the stuff I'll talk about, so you can go over there and get it. But magnesium oil, rub that all into the muscles of the lower extremity and around the knee. It's like a concentrated Epsom salt bath. And then a lot of people who have a lot of tightness, maybe a little deficiency in magnesium, so a little bit of magnesium rubbed into the muscles really may help. You could also get a stuff called natural calm magnesium, and that's a powder that you drink, and that's just going to allow you to get a little bit more magnesium into your system that also may help with the tightness. So deep tissue, check the arches, magnesium oil. As far as exercises, like I already mentioned, people say, oh, I need this very specific exercise. You know what? Go down and touch the floor and see if you can touch the floor. Can you do a squat? Can you do a lunge? Honestly, one of the best exercises you could do to kind of clear this up. Remember, that's where we want to start. We want to start by clearing everything up. And what I mean that is by loosening all that. And stretching is not really going to do it. Deep tissue is the way to start. And then what you want to do is lay on the floor and just stand up 20 times. Okay? Lay on the floor and just get up. Or do a few lunges. Now you gotta understand, there is this time that you might not want to do lunges, you might not want to do squats because of the knee pain. So honestly, yeah, you should have that checked out to make sure those exercises aren't hurting it. But if you're able to get off the floor, if you're able to do the squat without having knee pain, you're probably okay. So just doing really deep squats, just standing right here and going way down all the way down to the deep squat. A wall squat, sitting on the wall and just holding it. Turkish get up and laying on the floor and getting up. Those are the processes, and just start loosening everything up. And then, of course, you do want to get into strength training as far as really strengthening your glutes up. But what I see people doing, and you probably have done this, you probably searched the web, they come in, they're doing all this, it's foam roll, stretching, and some exercises, okay? And they're not getting the results. And because they're not getting the results because they haven't physically gone in there and broken that type of stuff up. You think you're doing it because you're doing it with the foam roller, but the foam roller just doesn't get in there specific enough in there. And you could if you're using the stick and you're finding those knots, like I said, start off with the deep tissue. Couple other little things that you could do is you could do some like infrared therapy, and you could just get an infrared therapy on Amazon for like $10. Plug that into light, and that warming that will help increase the circulation. So I hope that at least gets you in the right direction.